Usually someone notices asthma as a shortness of breath, some wheezing. Sometimes it'll be bad enough that it'll wake them from sleep. Often if they go to their primary care provider and are provided an albuterol inhaler, they'll notice that it actually gives them some relief after about 10 to 15 minutes. And if it happens only rarely, that might be all that's necessary. If you've been diagnosed with asthma and you're taking a lot more medication than you would like, or you find that you're using your inhalers more often than you think you should, then if you're talking to your primary care provider, there's an opportunity for more control. Then coming and seeing allergists sometimes can be very helpful because we can help pinpoint if there's another factor that's triggering it, such as allergies. One of the main things that you want to look for is, are you one of the 50% of asthmatics where allergies is an important factor? And if that's the case, if we treat your allergies, we can actually reduce significantly the amount of medication that you need to control your asthma and also make it so that your asthma flares less often. So although we don't cure the asthma, we can make it so that it's much less a prominent part of your life. A large number of professional athletes have asthma, and as you still see them on television or in the Olympics, they still do quite well. So it's a matter of you taking control of your asthma rather than letting your asthma take control of you. A lot of times people too feel like taking their inhaler is a sign of weakness, that they're going to get addicted to their inhaler. But actually, the inhaler is helping you. It's not actually causing a long-term problem, especially things like albuterol. Seasonal allergies can play a prominent role, but there are also a lot of what we call perennial or year-round allergens. A very prominent one in the Northwest is things like house dust mites because of the humidity level we have here. So dust mite allergen levels can be quite high in people's homes, and if you're one of the people who's sensitive to it, you can have year-round triggering of your asthma from that sensitivity. Well, the solution, once we find out what you're allergic to, can vary from anything from what we call environmental controls, where we kind of help you minimize your exposure, and that's honestly the best. But obviously some things you can't control. I can't control how much pollen comes out in the spring pollen season, and you certainly don't want to feel like you're a prisoner in your own home. So in those situations, we can do anything from some medications, and if it's severe enough, we can even recommend something called immunotherapy, where we can actually try to re-educate your immune system to ignore those allergens so that they aren't triggering your asthma or causing problems for you.